So in today's session again, we are looking at malaria as splenectomy, and this is coming from the December. Okay, this is of course coming from the December 2025 paper. So we'll go straight to look at how this scenario was asked. So the scenario reads, Mr. Josephat Dindi, aged 45 years, is admitted to the male surgical ward with a diagnosis of splenomegaly following severe infection with malaria. He is scheduled for splenectomy. Question A says, state 5 signs and symptoms of severe malaria. Question B, draw a well-labeled diagram of the life cycle of malaria infection in man. Question C, describe the preoperative management of Mr. Dindi on admission to the hospital. Question D, explain 5 ways of preventing malaria infection in the community. So we'll go straight to define malaria in case you're asked to define malaria. So you can define malaria as this is a protozoa infection of the blood caused by the genus Plasmodium, transmitted by the female Anopheles mosquito, characterized by fever, vomiting, and body weakness. Question, the other definition that you may ask to define is maybe splenectomy. You can define splenectomy as this is a surgical procedure involving the complete removal of the spleen through open surgery or laparoscopic procedure, characterized by severe abdominal pain, loss of consciousness, and hemorrhage. So that is how we can define the two in case you are asked to define. Now, going back to our question A, which said that state 5 signs and symptoms of malaria. These are the symptoms that you can state. The first one is, of course, fever. And fever, this is caused by the rupture of the red blood cells, which releases the mature parasites in the bloodstream and toxins, and this triggers the body's immune system to raise the body temperature as an indication that there's a presence of a foreign organism inside the body. Also, chills and rigors, which we commonly experience as shivering. This results from the sudden change in the body temperature as the fever rises, and rapidly, because it is rising very rapidly because of increased multiplication of the parasite in the body. Then we end up seeing these chills and fevers because they disturb the homeostasis of the body. Apart from that, sweating because of the increase in the body temperature and of course the cooling effect of the body. Because of that sudden rise in the body temperature, the body tries to lose this heat through sweat so that it does not go beyond what the body cells can tolerate. Headache as well, because of the increase in fever, dehydration, the inflammatory chemicals. All this impairs the circulation to the cerebral cells, causing headache. Generalized body weakness and fatigue because of anemia as a result of the destruction of the red blood cells, and this affects peripheral circulation. Other signs and symptoms, it's muscle and joint pain. This is because of the inflammatory mediators and toxins released by the parasites that affects blood and oxygen supply. Loss of appetite, this results from the systemic infection of fever and the effects of fever that it has on the digestive system, and this easily results in anorexia, which affects the patient's appetite. Nausea and vomiting, this is because of the irritation of the gastrointestinal tract and the effect of the malaria parasite toxins on the brain tissue. Dizziness is seen because of dehydration, fever itself, low blood sugar levels, low oxygen supply. This also results in dizziness. Generalized body weakness, just because of the overall systemic inflammatory response to malaria infection. So these are some of the symptoms that you can state, as the question requested to say you give an explanation by stating. Question B said, draw a well-labeled diagram of the life cycle of malaria infection in man. So when you look at this particular diagram, it has both the malaria infection inside the mosquito, and this side it is inside the man. So when we look at the life cycle of malaria parasite in man, we start from stage 1. So on stage 1, the mosquito is going to take up a blood meal, and during a blood meal, the mosquito injects the sporozoites inside the bloodstream of this human being. Now, once the sporozoites are injected in the bloodstream of this human being, the sporozoites are going to target, or are going to migrate rather, to the liver, and inside the liver the sporozoites are going to attack the liver cells, damage them, develop into schizons, and of course from schizons the malaria parasite is going to rupture that liver cell and release into the bloodstream what is known as the merozoites. So what you need to remember is that once the malaria parasite enters the human being's blood, it does not go straight to the red blood cells, but it needs to go to the liver. And from the liver, that is where it matures further by maturing from the sporozoid state to schizon state, which are segmented states. And the schizon state, when we say segmented, meaning that they are becoming millions of them, then ballooning the liver cell. Then once that liver cell balloons to a state where it cannot contain the parasite, it ruptures. And when it ruptures, it releases now the parasitic malaria parasite worm, which is the merozoite state. Now, from the merozoite state, which is happening at stage 4, the merozoites now will be released in the blood, and they will go in search of the red blood cell. Once the red blood cell is found, the merozoites are going to penetrate the red blood cell, and just like the way it happened inside the liver cell, the merozoites are also going to mature further into segmented state known as schizont, and the schizonts are going to further rupture the red blood cell and release again the merozoites. So the merozoites will continue to be released from each red blood cell, and when they are released again, they will attack more uninfected red blood cells, and the cycle will continue until millions and millions of RBCs are damaged and ruptured through this same process. Now, once a lot of erythrocytic cycles have taken place inside the human beings, these particular merozoites, instead of developing into schizons, but the merozoites are going to develop further into what is known as the trophozoite stage. And from the trophozoid stage, the trophozoites are going to mature further into gametocytes. And the gametocytes, you find that they will develop into the female version of the parasite and the male version of the parasite. That is what we call as the gametocytes. In other words, these gametocytes are known as the macrogametocytes and the microgametocytes, which is where the macro is the female version, the micro is the male version. So from the merozoite stage, instead of developing to the schizon state inside the human being's body, they will develop into the trophozoite state and then into the gametocyte state. And that is what happens at stage 7. And at stage 7 is still, and at stage 8 rather, another mosquito is going to take a blood meal. And once this mosquito takes a blood meal, it is going to suck or ingest the gametocytes. And once the mosquito ingests the gametocytes, at that moment the life cycle in man has ended, because it has now moved on into the mosquito. So that is what you need to draw based on this particular question. You are just drawing half of this particular cycle as requested by the question. You don't talk about this particular component. So if you want to know more about this particular complete life cycle, still go through the notes and understand what is happening in the mosquito as well. So that is what was needed for this particular question, and that is the explanation. But the question just requested your drawing and no explanation, but sometimes they may still request for your explanation. Now, when we go to question C, it was describe the pre-operative management of Mr. Dindi on admission to the hospital. So now in this particular case, again, your focus is that the patient has, of course, severe malaria, but they have come in with splenomegaly, which requires splenectomy. And what you need to remember is that now this is an emergency pre-op because of the nature of the organs that is affected. And here now you need to write the emergency pre-op amongst the pre-operative managements that you're applying. And the emergency pre-op, you talk about aims. From there, talk about a small introduction. Talk about patient resuscitation, where you talk about airway, breathing, talk about circulation. From there, talk about pain management. And of course, you move on to observations, talk about investigations, psychological care. Apart from that, consent form, talk about the physical preparation on your pre-op. And amongst the physical preparation, you talk about gastric preparation, talk about bowel preparation, talk about bladder preparation, leukocyte or skin preparation, removal of jewelry or dentures, talk about patient identification. From there, of course, you move on to pre-medication, gowning, and of course transfer of patient to theater and post-operative bed, and the last heading becomes communication with the family. So this is the emergency pre-op that you need to apply in this particular condition, the way this scenario was. The last question was talking about explain 5 ways of preventing malaria infection in the community. And amongst ways of preventing malaria infection, we talk about use of insecticide treated nets, because using sleeping under a treated mosquito net, this will prevent at least exposure or direct biting from mosquitoes. From there, indoor residue spraying can also help eliminate mosquitoes that are being harbored within the house. From there, of course, use of anti-malarial chemoprophylaxis. This will at least prevent malaria because the patient would have taken drugs to prevent malaria way before they are exposed to the parasite. Use of personal repellents. This will at least prevent or reduce chances of being bitten by mosquitoes. Apart from that, protective clothing. This also reduces surface areas for biting surface areas for mosquitoes, because most of your body parts are covered with clothing. And of course, environmental management, like covering pools of water, cutting down tall trees. All this can help reduce harboring areas for mosquitoes where they can breed from. So that is about how we can talk about the preventive measures of malaria, and you of course explain them in details as given as an example on these particular slides. So that's all for today. Till next time, goodbye. As usual, sharing of these materials without consent from myself, it is illegal and prohibited.